Thank you very much, Bonsai Betty. We will have a great Monday. All right, every Monday we get a chance to welcome in a specialist. This morning we're talking with Dr. Clayton Chong about lung cancer therapies and an evolving therapy. You know, when I looked at this and we saw the development of lung cancer, it stunned me is just how small this starts out as. I mean, it could be as small as a few centimeters, correct?
Yes, and you can be totally without any symptoms at all, as I mentioned earlier. Or you can have a chronic cough or an infection that doesn't go away or suspicion of other problems in the lungs. So it can be very nonspecific.
How does it get started? Or how is it different in men and women? Or is it different between men and women?
Well, we don't know what really starts lung cancer, but we know that there are certain agents that can promote it, like smoking is one of the carcinogenic agents. Men and women, there's not a whole lot of difference, except in women you have a higher frequency of a certain type of lung cancer called adenocarcinoma, and it does not have to be associated with smoking at all. Now, some of the newer therapies, as we will talk about at the Queen's Conference on Wednesday, is about the evolving frontiers in treatment of cancer. And in certain cancers, based on the molecular structure, there are different therapies. And women tend to have some gene traces that are more prone to certain kind of treatments in a higher frequency than men. So that may be one of the differences in women and men as far as lung cancer.
Are there things we can do to prevent lung cancer?
Well, we can try to avoid smoking, or now today the big buzz is passive smoking. But outside of that, it's just being aware and being very conscious about your own health.
When it'll be, you said Wednesday that you guys
Wednesday at the Queen's at the Queen's Medical Center, they have a public speaking conference that's open to the public, and they're talking about the evolving frontiers in cancer treatment.
What time's it get underway?
That's about 5 o'clock in the evening.
Okay. Dr. Chong, thank you so much. We appreciate it, and this is obviously troubling this lung cancer, and we appreciate any sort of knowledge that we can give to folks to kind of help them keep an eye out for something like that.
My pleasure.
Thank you, Dr. Chong. All right, still to come on Wake Up Today, we're talking about a world record, and it is really way up.